objective here is to apply our knowledge of the neuromuscular junction in understanding the natural toxins that target the neuromuscular junction. And then we're going to talk about some clinical correlations about how those affect our skeletal muscle function. So we're going to speak about 3 toxins that influence this region, the neuromuscular junction. And then I'm also going to speak about a disorder that has an influence here at the NMJ as well. So the first toxin is called latroxin, and latroxin is actually found in the venom of a black widow spider. And the way that latroxin acts is by stimulating the excess release of acetylcholine. So our neurotransmitter acetylcholine is released in excess quantities upon the introduction of this venom called latroxin into the system. And because we have excess release of acetylcholine, this is going to continually stimulate these receptors. This is going to continually create our end plate potential. And as you would guess, this is going to cause spastic contractions of our skeletal muscle. And the way that this becomes fatal or detrimental is because our skeletal muscles, specifically our respiratory muscles, such as the diaphragm and our intercostal muscles, when they are continually spastically contracting, they make it very hard for us to effectively bring in oxygen and effectively ventilate our lungs and breathe effectively. And so patients who have been bitten by this black widow spider typically expire as a result of respiratory dysfunction. So they're unable to adequately breathe because there's this spastic continual contraction of the respiratory muscles, and that becomes fatal in that way. Okay, so that's our first toxin that influences the neuromuscular junction. The second toxin is called crotoxin. And crotoxin acts in the exact opposite of latroxin. Crotoxin comes from the venom of a rattlesnake. And the way that crotoxin behaves is that it inhibits or blocks the release of acetylcholine at the neuromuscular junction. And as you would guess, this is going to be the opposite effect of what we saw with our black widow spider venom. This is going to block the release of acetylcholine, and so it's going to block the ability for the motor end plate to receive this neurotransmitter and to contract or to stimulate an end plate potential. And so instead of seeing spastic contraction, here we see paralysis. So absolutely no contraction, and this is obviously going to cause dysfunction. And again, the way this becomes fatal is the involvement of our respiratory muscles. Our respiratory muscles are very sensitive to disorders of the neuromuscular junction and to any type of muscular dystrophies, because these are the one group of skeletal muscles that we need in order to sustain life. If we lose the ability of the skeletal muscle of the diaphragm to contract and relax, we lose the ability to sustain respiration on our own. And that can become fatal very quickly. All right, so that's our second toxin, crotoxin, which results in paralysis and then respiratory dysfunction if it is left untreated. Our third toxin is called curare, and curare is found in a natural pigment, sometimes used by Native Americans. They put it on the end of their darts, and this is how they paralyze their prey, typically when they're out hunting. And the way that curare affects the neuromuscular junction is by blocking our nicotinic cholinergic receptors. So it's going to have a very similar clinical effect as crotoxin, in that it will inhibit or impede the end plate potential, but the etiology, the reason is going to be a little bit different. So crotoxin blocks the release of acetylcholine, whereas curare is going to block the receptor altogether. So imagine if we're blocking this receptor, we're also going to see paralysis. We're going to see inability for this end plate potential to occur, therefore inability for our skeletal muscles to contract. Okay, and this is how hunters or native peoples typically paralyze their prey in order to catch it, is by putting this curare found in this natural pigment at the end of the dart, and then shooting that dart into the animal or the prey, and then paralyzing it because we cannot stimulate that end plate potential. Okay. And the fourth sort of clinical correlation that I'll make here with the neuromuscular junction is with a disorder called myasthenia gravis. So myasthenia gravis very much mimics the effect that we see with Cure-Rare. So myasthenia gravis is where we have this autoimmune disease where our body, our immune system essentially attacks our nicotinic cholinergic receptors. And so it damages or destroys the number of these receptors that we have because the body has created these antibodies against these receptors. And this also presents very similarly with muscle paralysis and weakness and can progress to become fatal when it involves the respiratory muscles. And so the way that we treat myasthenia gravis is another important correlation to what we should already know here about the neuromuscular junction. We typically give medication or drugs that block acetylcholinesterase. And if we can think about that, the acetylcholinesterase enzyme is clearing the excess neurotransmitter from the neuromuscular junction. So if we can block this enzyme, we can block the clearing of the junction, and we can allow any excess neurotransmitter to really linger or stay around at the neuromuscular junction just a little bit longer than if we had this acetylcholinesterase enzyme present. And so that use of the understanding of the neuromuscular junction is one way that we can combat myasthenia gravis, and we can sort of get some relief or treat some of the symptoms that are involved, some of the weakness and paralysis that we see associated with that